The critical role of caregivers in supporting patients with prostate cancer. 77% of caregivers are involved in encouraging their patients' first screening. They have Dr. Daniel George and Gina Carruthers, if I'm saying that right, President and CEO of Prostate Cancer Foundation. Of course, Dr. George is medical oncologist and professor at Duke University School of Medicine. Boy, I like your basketball team. Good morning to both of you.
Happy to be here. Thanks, James.
Morning, James.
Good morning. Dr. George, can you tell us about the prostate cancer and which men are at the greatest risk of being affected?
Sure. James, the truth is all men are at risk for developing prostate cancer as they age, but there are some groups that are at greater risk. Men with a family history of prostate cancer are at greater risk of developing it themselves. And as well, men who identify as Black or African ancestry, they're at greater risk of developing prostate cancer in a more aggressive form of prostate cancer. So screening is really important. And then lastly, we recommend screening in all men through a simple PSA blood test. This is a test that your primary care doctor can order, and we recommend that between age 45 and 50. If that level as sort of a screen is above 1.6, then you're at increased risk of developing prostate cancer in your lifetime. So these are the three groups we recommend very close follow-up on for prostate cancer screening.
Gina, what are some ways caregivers can support their loved ones during their prostate cancer journey?
Sure. And so initially in that screening phase, it's really important that men, once they get their baseline PSA or turn the age of 50, if they're not at elevated risk, that they're actually getting an annual blood test screening for prostate cancer. And if in fact that blood test indicates that they have gotten, or it appears that they're getting prostate cancer, that caregiver can not only support that patient through the journey, but can help by finding resources, education materials, etc., that keep them informed. And also we find many caregivers go to the doctor's appointments, meet with the healthcare provider along with the patient. And they can not only help that patient navigate treatment decisions that they're making, but also help keep that patient informed, and then also support that patient's well-being through physical exercise, good nutrition, and just an overall sense of enjoying daily living while going along this journey.
Doctor, how is the prostate cancer treatment landscape evolving?
James, it has changed tremendously in the last 10 years. We have new diagnostics and in early stage prostate cancer to really help us fine-tune the treatments that men need for disease control and eradication without over-treating. And for men with advanced prostate cancer, we have changed this whole prognosis. 10 years ago, patients who had disease that spread outside their prostate had an average survival of 2 to 3 years. Now, that's 7 to 10 years, and probably longer in some men. So this has become a chronic disease, even for our worst case scenarios. So prostate cancer is something people can live with no matter what stage you're at. It's important to recognize that this progress has involved new therapies, new drugs, new combinations, approaches to prostate cancer. And to understand more about those approaches, we have a new website called advancedpctreatment.com. All one word, advancedpctreatment.com.
Gina, what resources are available to help patients and caregivers feel more supported?
Sure, James. So one of the things, the Prostate Cancer Foundation has recently launched a new website, pcf.org, that provides all of the background about the disease, about the various diagnostics, decision-making, and finally treatments. In addition, we have webinars for patients and for the caregivers, offering them support and guidance from everything around treatments to nutrition, etc. And then as Dr. George mentioned, there's also this new website that's called advancedpctreatment.com. And that website also provides tremendous resources to help patients navigate the combination treatment landscape when they're in advanced disease.
Dr. George, Gina, thank you so much for joining us on Morning Blend and talking about this very important disease. Thank you again for joining us.
Thank you, James.
Thank you, James.